There are moments when the human body whispers before it ever screams. Moments so quiet and easy to ignore that they slip into daily life unnoticed. Until one day you realize something has been wrong for far longer than you want to admit. And this is one of those stories. A story that doesn't start with dramatic hospital scenes or flashing warning signs, but with small doubts, lingering thoughts, and an uneasy feeling that something deep inside isn't quite right. Bone cancer, particularly osteosarcoma, doesn't announce itself loudly at first, and that's what makes it so unsettling, because it often grows in silence, hidden beneath muscle and skin, inside the very framework that holds your body together, quietly changing things while life goes on as normal. Imagine trusting your own strength, your movement, your youth or health, believing your bones are solid and reliable, only to discover later that something has been slowly weakening them from the inside, something you never thought to question. This disease has a way of attacking not just the body, but the sense of safety we all carry. The belief that what's inside us is stable, that pain or discomfort always has a simple explanation, that serious illnesses happen to other people, not you. Osteosarcoma challenges that belief in a deeply unsettling way, because it can exist long before it is named, long before answers are given, creating a dangerous gap between what you feel and what is actually happening. And that gap is where fear lives. The fear of not knowing, the fear of waiting, the fear of realizing too late that the body you depend on every day has been fighting a battle you never saw. Bone cancer is especially haunting because bones are supposed to be strong, silent supporters of life, not places where something so aggressive can take root, and yet it does, often in people who never imagined they'd be vulnerable. The idea that something could be growing inside the skeleton, the very structure that allows you to stand, walk, run, and live freely, is enough to make anyone pause and reflect on their own body in a new, uneasy way. It raises questions no one wants to ask themselves, questions about what we ignore, what we explain away, and how much we truly listen to our bodies when they try to get our attention. Osteosarcoma doesn't just affect physical health. It disrupts plans, futures, and identities, forcing people to confront uncertainty head-on, sometimes without warning. It has a way of turning ordinary days into moments of quiet anxiety, where a simple ache or a fleeting thought suddenly feels heavier than it should. And that's why this conversation matters, because awareness begins long before diagnosis, and understanding begins with paying attention to the stories we usually don't tell ourselves. This isn't about panic, but about respect for the complexity of the human body and the reality that serious diseases don't always arrive with dramatic entrances. Sometimes they slip in quietly, counting on us to look away. If you've ever felt a strange sense of unease about your own health, ever wondered if something small might mean something bigger, or ever dismissed a thought because it felt too frightening to explore, then this is something you need to hear. Bone cancer doesn't just change lives when it's discovered. It changes how we think about our bodies, our assumptions, and the importance of listening before it's too late. Bone cancer, specifically osteosarcoma, is a serious and rare disease where abnormal cells begin to grow inside the bone itself, not on the surface, but deep within the hard structure that gives your body strength and shape. And these cells do not behave the way healthy bone cells should. Instead of growing in an organized, controlled way, they grow aggressively and form a mass that can damage and weaken the bone from the inside. To understand this, it helps to remember that your bones are living tissue, constantly renewing themselves, repairing small damage, and supporting every movement you make. And osteosarcoma develops when this natural process goes wrong and cells start multiplying without control. This type of cancer most often begins in the long bones of the body, like those in the legs or arms, areas that carry weight and allow motion, which is why it can have such a powerful impact on daily life. What makes osteosarcoma especially frightening is not just that it affects the bones, but that it tends to grow quickly and can spread to other parts of the body if not found in time, particularly to the lungs, which adds another layer of seriousness to the condition. For many people, the idea that cancer can start inside a bone feels almost unreal, because we don't usually think of bones as places where disease begins. Yet osteosarcoma reminds us that no part of the body is immune to illness. This disease can affect children, teenagers, and young adults more often than other age groups, which makes it emotionally devastating, as it often appears during periods of growth, activity, and future planning, though adults can develop it as well. From a medical point of view, osteosarcoma is considered a primary bone cancer, meaning it starts in the bone rather than spreading there from somewhere else. And that distinction matters because it shapes how doctors understand and manage the disease. Even though it is rare, when it does occur, it demands serious attention, careful testing, and a coordinated medical approach, because the bone is not just a structure, but a vital, living part of the body connected to muscles, blood vessels, and nerves. Living with the possibility or reality of osteosarcoma can feel overwhelming, and it's completely normal to feel fear, confusion, or even disbelief when learning about it. But understanding what this disease actually is can bring a sense of clarity and grounding in a situation that often feels out of control. Knowledge does not erase fear, but it can replace panic with awareness and help you feel less alone as you move forward. If you're listening to this because you're worried about yourself or someone you love, know that paying attention, learning, and staying engaged is a powerful first step, and you don't have to face these questions in silence. Stay with this conversation, because understanding leads to strength, and strength begins with being informed and supported. When we talk about what causes osteosarcoma, it's important to approach this gently and honestly, because for many people, the hardest part is accepting that this disease is not something you caused or could have easily prevented, and that alone can bring some relief. Osteosarcoma begins when the normal process of bone growth and repair goes wrong at a cellular level, and instead of healthy bone cells forming in a controlled way, some cells begin to grow out of control and behave abnormally. Bones are constantly changing, especially during childhood and teenage years, when the body is growing quickly, and this rapid growth seems to play a role in why osteosarcoma is more common in younger people. During growth spurts, bone cells divide more often, and with more division comes a higher chance that something can go wrong in the genetic instructions that tell cells how to behave. These changes are not inherited in most cases and are not the result of lifestyle choices. They are random mistakes that happen inside cells. In some people, certain genetic conditions can increase the risk, meaning their cells are more vulnerable to these errors. But even then, developing osteosarcoma is still rare. Previous exposure to high levels of radiation, often from medical treatments given years earlier for other cancers, can also increase risk, especially if the radiation involved bones that were still developing at the time. This does not mean common imaging tests are dangerous, but rather that very high, repeated doses used in past cancer treatments can affect bone cells over time. There are also rare bone conditions where bones are already abnormal or weakened, and in those situations, the risk may be slightly higher, particularly later in life. Still, for the vast majority of people diagnosed with osteosarcoma, there is no single clear cause that can be pointed to, and that uncertainty can be frustrating and frightening. Many patients ask themselves what they did wrong, whether they missed a sign, or whether a different choice could have changed things. And as a doctor, I want you to hear this clearly. Osteosarcoma is not caused by exercise, injuries, diet, stress, or anything you did or didn't do. It is not contagious, and it is not the result of weakness or neglect. It is a complex disease that develops quietly, often without warning, and blaming yourself only adds emotional pain to an already difficult situation. Understanding the causes is not about finding fault, but about understanding the nature of the disease so you can face it with knowledge instead of fear. When you realize that many of these changes happen beyond anyone's control, it becomes easier to focus on what truly matters now, which is awareness, support, and moving forward with care. If this information brings up worry or makes you think more deeply about your own health or someone you love, I encourage you not to carry that concern alone. Talk to a healthcare professional, ask questions, and stay engaged in learning, because seeking understanding is an act of strength, and staying informed and connected can make even the most uncertain path feel a little less lonely. When it comes to the symptoms of osteosarcoma, what makes this disease so difficult is that the early signs are often quiet, confusing, and easy to explain away, which is why listening to your body with care really matters. Many people first notice pain, but not the kind of pain that feels sudden or dramatic. It often starts as a dull ache deep inside a bone, something that comes and goes, something that might feel worse at night or after activity. And it's very common for people to assume it's from exercise, growth, a minor injury, or just overuse. Over time, that pain may become more constant or more intense, and it may begin to interfere with sleep or daily movement. Yet even then, many people push through it, telling themselves it will pass. As the abnormal cells grow inside the bone, they can weaken its structure, and this may lead to swelling or a visible lump near the affected area, which can feel firm or tender to the touch. Sometimes the skin over that area may feel warmer than usual, not because of infection, but because of increased activity beneath the surface. Movement can start to feel limited, especially if the cancer is near a joint, making it harder to bend, walk, or use an arm comfortably. And this stiffness may slowly change the way a person moves without them fully realizing it. In some cases, the bone becomes so weakened that it can fracture with very little force, which can be shocking and frightening, especially if it happens during normal activity. Beyond the bone itself, the body may also show more general signs that something isn't right, such as ongoing fatigue that doesn't improve with rest, unexplained weight loss, or a general feeling of being unwell that lingers without a clear reason. These symptoms can be subtle and easy to overlook, especially in young people who are otherwise active and healthy, but together they can form a pattern that deserves attention. What's important to understand is that these symptoms do not automatically mean cancer, and many harmless conditions can cause similar discomfort, but when pain persists, worsens, or feels different from anything you've experienced before, it's your body asking to be heard. Too often, people delay seeking help because they don't want to overreact, they don't want to be a burden, or they're afraid of what they might hear, and those feelings are deeply human. As a doctor, I want you to know that paying attention to symptoms is not a sign of weakness or fear, but a sign of self-respect and care. Early evaluation can make a meaningful difference, and even if the outcome is not what you fear, the peace of mind that comes from understanding what's happening in your body is invaluable. If anything you've heard today feels familiar or stirs concern in your heart, please don't ignore it or carry it alone. Reach out to a healthcare professional, talk openly, ask questions, and give yourself permission to take your health seriously, because you deserve clarity, support, and hope, and taking that first step could be more powerful than you realize. When we talk about treatment and solutions for osteosarcoma, I want you to hear this as clearly and calmly as possible, because even though this disease is serious, there are real paths forward, and many people go through treatment with strength they never knew they had. Treatment usually involves a combination of approaches that work together, because osteosarcoma is not something we rely on just one method to fight. Most patients begin with strong cancer-fighting medicines that travel through the bloodstream to reach cancer cells wherever they may be, including areas we cannot see on scans, and these medicines are carefully chosen to shrink the tumor, slow its growth, and reduce the risk of spread. This phase can feel intimidating, and it's normal to worry about side effects or how your body will handle it. But you are closely monitored, supported, and adjusted every step of the way, and the goal is always to balance effectiveness with safety and quality of life. After this, surgery often becomes an important part of treatment, with the aim of removing the tumor completely while preserving as much normal function as possible. Advances in medical care mean that in many cases, doctors can save the limb and restore movement using specialized techniques, allowing people to walk, move, and live actively again, even after major surgery. Recovery takes time, patience, and physical rehabilitation, and there may be days when progress feels slow, but healing is rarely a straight line, and every small improvement matters. In some situations, additional treatments may follow to make sure remaining cancer cells are destroyed and to reduce the chance of the disease returning, and this is planned very carefully based on each individual's response and needs. Beyond the medical treatments themselves, true care also includes emotional and psychological support, because cancer affects far more than just the body. Fear, uncertainty, and exhaustion are real parts of this journey, and having a strong support system, whether through family, friends, counselors, or support groups, can make a powerful difference. Nutrition, gentle movement, and rest also play important roles in helping the body recover and rebuild strength, and your healthcare team can guide you through these steps with compassion and realism. What I want you to remember is that treatment is not about punishment or suffering. It is about giving your body the best chance to heal and move forward. Many people who once felt overwhelmed and frightened go on to find stability, purpose, and even renewed appreciation for life after treatment. And while the road can be challenging, it is not walked alone. If you or someone you love is facing osteosarcoma, please know that asking questions, seeking second opinions, and staying informed are not signs of doubt, but signs of courage. Stay connected to your care team. Lean on the people who want to support you, and don't lose sight of hope, because even in the hardest moments, progress is possible, healing can happen, and your story is still being written. So keep listening, keep learning, and take each step forward with trust and care. As we come to the end of this conversation, I want you to take a quiet moment and simply breathe, because learning about something as serious as this can stir fear, questions, and emotions you may not have expected, and all of that is completely okay. Whether you're here because of a personal worry, a loved one's diagnosis, or a desire to understand more, the fact that you stayed and listened says something important about you, and that is that you care deeply about health, about life, and about being informed rather than turning away. Osteosarcoma can feel overwhelming when you first hear about it, but knowledge has a way of gently replacing fear with clarity, and clarity gives you the strength to take the next step, whatever that step may be. You don't have to have all the answers right now, and you don't have to make big decisions alone or all at once. What matters most is staying aware, staying connected, and staying kind to yourself through the process. If something you heard today resonated with you or raised concerns, let that be a reason to reach out rather than retreat, to talk with a healthcare professional, to ask questions without shame, and to trust that your voice and your feelings matter. And if you're supporting someone else through this journey, remember that your presence, your patience, and your willingness to listen are powerful forms of care, even when you don't know what to say. Healing is not only about medicine or procedures, it's also about feeling seen, understood, and supported, and those things truly make a difference. If this video helped you feel less alone or gave you a better understanding of what osteosarcoma really is, I gently invite you to stay connected, to continue learning, and to share this information with someone who might need it, because you never know whose quiet worries it might ease. Your attention, your compassion, and your willingness to learn can ripple outward in ways you may never fully see. Take care of your body, listen when it speaks, and don't ignore the small signals that ask for kindness and attention. And above all, remember that even in the face of uncertainty, there is always room for hope, for support, and for forward movement. Thank you for spending this time here. And if you need more guidance, reassurance, or understanding, you are always welcome to keep listening, keep asking, and keep choosing care, because your health and your life are worth that attention.